Today, I want to have an important conversation with you about a topic that many people find difficult to discuss: nursing homes. I know that just hearing those words might bring feelings of uncertainty, worry, or even sadness. Perhaps you are considering moving into a nursing home yourself, or maybe you have a loved one who is already there, and we often assume that it will be a safe place, a second home, right? But today, I want you to rethink that assumption. Imagine this. One morning, you wake up and want to sit up, but there's no one to help you. Breakfast hasn't arrived yet, even though you press the call button multiple times. And it's not just one day. This happens over and over again. And if you don't speak up, no one knows. No one notices. I'm not saying that all nursing homes are like this. There are wonderful facilities with dedicated staff who truly care. But I want you to understand that there are things no one talks about. Some places are understaffed, lacking proper care, and in the worst cases, serious medical mistakes happen, or even neglect and abuse, where the residents themselves cannot speak up. I know this is not easy to hear, and I also understand how hard it is to make decisions about living in a nursing home. No one wants to lose their independence, but if we don't prepare, if we don't understand the risks, then who will protect us? That's why today, I want to have an honest conversation with you. I will share the 5 biggest risks in nursing homes, the things that no one tells you, and most importantly, how you can protect yourself or your loved ones. So why don't you grab a warm cup of tea, get comfortable, and let's talk, just like friends discussing an important part of life. Before we begin, if you're committed to living a healthier, more fulfilling life, hit the like button to help spread this valuable knowledge. If you haven't subscribed yet, make sure to click subscribe and turn on the notification bell so you never miss a video. And if you're enjoying this content, comment 1 below to let me know you're here. If not, comment 0, and I'll work harder to bring you even better content. Are you ready? Let's begin. Risk 1. Poor quality of care due to lack of staff. Imagine this. One day, you need help getting out of bed, but no one comes. You need to use the restroom, but you have to wait for hours. It's time to take your medication, but the staff forgets. Unfortunately, this is not uncommon in many nursing homes today. Did you know that 80% of nursing homes in the US do not have enough staff to properly care for elderly residents? This means that each staff member is responsible for 10 to 15 residents at a time, an overwhelming number that makes it impossible to give everyone the attention they truly need. I understand that when you or your family decide to move into a nursing home, it's because you expect better care, someone to assist you when needed. But the reality is, this isn't always the case. When staff are overworked, who will be there to help you stand up when you need to? Who will notice if you've been left alone for hours? Many residents struggle to move on their own, wishing for a helping hand, but often there's no one around. And this leads to one of the most dangerous risks: falls. Let me tell you the story of Mrs. Helen, 82 years old. One morning, she woke up and went to the bathroom as usual, but this time, her legs were weaker than before, and she slipped. She tried calling for help, but no one heard her. She lay on the cold floor for 3 hours, unable to move, unable to do anything but wait. By the time someone finally found her, she had suffered a hip fracture, a serious and life-threatening injury for older adults. If someone had arrived earlier, she wouldn't have had to endure such pain, but because there were not enough staff members on duty, she had to go through an experience no one should ever have to face. And the problem doesn't stop there. When there aren't enough caregivers, not only do mobility and personal care suffer, but even medication schedules are affected, which is critical for older adults. There have been numerous cases of residents receiving the wrong medication, missing doses, or taking the incorrect amount, leading to dangerous consequences. Skipping one pill might not seem serious, but repeated mistakes can silently weaken a person's health before anyone realizes what's happening. So, what can you do to protect yourself or your loved ones from this situation? Do not rely solely on advertisements. Take the time to thoroughly research and visit the nursing home before making a decision. Ask about the staff-to-resident ratio. If one caregiver is responsible for too many people, ask yourself, will I receive the care I need? Ask about nighttime supervision. During the day, staff may be around, but what happens at night? If there aren't enough people on duty, what will happen if you need help in the middle of the night? Check the emergency call system. Does the facility provide emergency call buttons? More importantly, do they actually respond quickly when a resident presses it? Test it. Press the button and see how long it takes for someone to arrive. If you have to wait too long, that is a major red flag. I know many of you may be considering a nursing home for yourself or have a loved one already living in one. Remember, quality care is not just about fancy buildings or promises on paper. It's about the people who will be taking care of you every single day. A well-staffed nursing home with a strong support system ensures that you live safely, receive the care you deserve, and are never left behind. But if a facility does not have enough caregivers, the risks of falls, medical errors, and lack of immediate assistance become dangerously high. So before making any decision, ask the right questions, observe carefully, and ensure that you or your loved ones will truly be cared for. If you're still watching this video and find these insights valuable, comment 1 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Risk 2. Elder abuse, violence, and emotional abuse. Older adults deserve to spend their final years in dignity, love, and proper care. But the sad reality is that not everyone is treated this way. According to a report by the World Health Organization, 1 in 6 elderly individuals in nursing homes experiences abuse, not just physical violence, but also emotional mistreatment and neglect. This is an alarming statistic. People assume that nursing homes are safe, but the truth is, if no one is paying close attention, older adults can be mistreated without anyone knowing. Imagine waking up every day only to be yelled at for taking too long in the restroom, ignored when you need assistance, or worse, being shoved, grabbed forcefully, and left with bruises. These actions are not uncommon. Many elderly individuals remain silent out of fear of retaliation or because they believe they have no other choice. Those who were once strong, who raised families, now endure mistreatment in silence, with no one to defend them. Take the heartbreaking case of Mr. David, a 79-year-old man who was once lively and loved, talking to his grandchildren. But after moving into a nursing home, his family noticed a drastic change. He barely spoke, his eyes constantly filled with anxiety. When asked, he simply said, "Everything is fine." Then one day, he was rushed to the hospital for severe dehydration. Doctors revealed that he hadn't been given enough water for days. His family, shocked and furious, investigated the nursing home and discovered that staff members regularly yelled at him, failed to bring him water on time, and ignored him when he needed help. No one in his family could have imagined that a place meant to care for the elderly could treat him so cruelly. So how can you recognize signs of abuse? Pay close attention if your loved one has unexplained bruises or scratches. Do not immediately accept the nursing home's explanation that they just fell. If your loved one's personality suddenly changes, if they seem fearful, anxious, or unwilling to speak, it may be a sign of emotional abuse or mistreatment. Another red flag is rapid weight loss, which could indicate that they are not being fed properly or are being neglected in their basic care. If you suspect that your loved one is being mistreated in a nursing home, do not hesitate to act. Visit them frequently and at unexpected times, especially in the evenings when there are fewer visitors around. Observe how the staff treats other residents. If they are impatient, rude, or aggressive, chances are they behave the same way when no one is watching. Another way to protect your loved one is by setting up a monitoring system. In some U.S. states, families are allowed to install cameras in private rooms to oversee the quality of care. If you suspect something is wrong, find a way to gather evidence. But most importantly, trust your instincts. If something feels off, there is a real possibility that something is truly wrong. No one deserves to suffer abuse in their final years. A nursing home can be a safe place, but only if there is strong oversight from families and the community. You have the right to be treated with kindness, dignity, and respect. Do not let anyone take that away from you. If you're still watching this video and find these insights valuable, comment 2 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Risk 3. Hygiene problems and disease. Infection. Older adults deserve to live in a clean, safe environment where they can feel comfortable and maintain their health. But did you know that nursing homes are among the places with the highest rates of infectious disease transmission? Influenza, pneumonia, COVID-19. These illnesses can spread rapidly and pose a severe threat to individuals with weakened immune systems. The problem isn't just age, but also the quality of sanitation in these facilities. If a nursing home is not properly cleaned, the risk of infection increases significantly. Imagine a room where bed linens are not washed regularly, restrooms are damp and filled with unpleasant odors, or wheelchairs and walking canes are not disinfected after use. This is not just an issue of cleanliness, but a breeding ground for bacteria and viruses. If just one resident falls ill, the entire nursing home can be affected because infections spread too quickly. Staff members who fail to wash their hands properly, medical equipment that isn't sterilized, these factors turn nursing homes into hotspots for disease, often unnoticed until it's too late. The story of Margaret, an 84-year-old resident, is a perfect example. When she first moved into a nursing home, she was in good health and only needed assistance with daily activities. But within a few months, she developed a persistent cough and began struggling to breathe. Staff assured her it was just a mild cold. However, she was later hospitalized with severe pneumonia. Doctors discovered that she had contracted a bacterial infection from her surroundings. When her family investigated further, they found that several other residents in the facility had respiratory illnesses and that the hygiene protocols were alarmingly lax. Staff members weren't wearing gloves while assisting residents with meals, wheelchairs weren't disinfected after each use, and restrooms were not cleaned as often as they should have been. This is not an isolated case. Many nursing homes lack the workforce to maintain strict hygiene protocols. When there is no oversight, cleanliness can be neglected. A facility meant to protect the elderly can instead become the very source of dangerous illnesses. For younger individuals, a common cold might be a minor inconvenience, but for older adults, it can escalate into pneumonia, respiratory failure, or even death. So how can you protect yourself or your loved ones? Before choosing a nursing home, ask about their cleaning procedures. How often are bed linens washed? Are restrooms cleaned daily? Is medical equipment sterilized after each use? A reputable nursing home will be transparent about these details. Additionally, observe how staff members practice hygiene. Do they wash their hands before assisting residents? Do they wear gloves when providing care? These seemingly small details can make a significant difference in preventing the spread of infections. Finally, ensure that the nursing home has a plan in place for isolation and infection control during an outbreak. During the COVID-19 pandemic, many nursing homes suffered devastating losses due to poor preparation and lack of preventive measures. If a facility does not have strict infection control protocols, your loved ones could be put at risk without even realizing it. Hygiene and infection control are not minor concerns. They are matters of life and death for older adults in nursing homes. By being proactive, asking the right questions, and staying vigilant, you can ensure that your loved ones receive the care and protection they deserve. If you're still watching this video and find these insights valuable, comment 3 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Risk 4. Poor nutrition, malnutrition. Have you ever wondered whether the daily meals in a nursing home provide enough nutrition to keep the body healthy? The sad reality is that many nursing homes cut costs by relying on processed foods that lack fresh vegetables and are high in salt and sugar, far from what older adults truly need. The food may be served hot, but inside, it lacks the essential vitamins, minerals, and proteins necessary to maintain health. Imagine yourself or a loved one eating the same bland soup, dry white rice, and a small portion of canned meat every day. It sounds simple, but for many nursing homes, this is the standard menu. The lack of vegetables, fiber, and protein quickly leads to declining health. A meal isn't just about feeling full, it must provide the nutrients needed to fight illness, maintain muscle strength, and protect bone health. The consequences of a poor diet can be more severe than you might think. Without sufficient protein and calcium, bones become fragile, muscles weaken, and the risk of falling increases significantly. A study by the American Society for Nutrition found that malnourished older adults are 40% more likely to suffer fractures than those with a well-balanced diet. Additionally, a low-fiber diet often leads to chronic constipation, a frustrating but common issue among the elderly. Dehydration is another serious concern, causing dizziness, headaches, and even worsening cognitive decline. Consider the story of Bill, an 82-year-old man who was in good health before moving into a nursing home. At first, his weight remained stable, but within 6 months, he lost over 10 kilograms. His family noticed a drastic change. His steps became unsteady, he was constantly fatigued, and he even showed signs of confusion. Upon reviewing the facility's meal plan, they discovered that it consisted mostly of industrially processed foods, with little to no fresh vegetables, minimal protein, and excessive salt. Bill's body was deprived of the necessary nutrients to maintain his strength, and muscle loss had begun affecting his mobility. So how can you ensure that you or your loved one doesn't experience the same fate? Before choosing a nursing home, ask to see the daily menu. Inquire about whether they provide sufficient fresh vegetables, protein from fresh meat and fish, and fiber-rich foods. If the meals are primarily frozen or pre-packaged, consider it a red flag. Additionally, check whether the facility offers specialized dietary options. If you or your loved one requires a low-sodium, low-sugar, or high-protein diet, make sure the nursing home can accommodate these needs. Don't let a poor diet compromise health simply because the right questions weren't asked from the start. Proper nutrition is not a luxury, it's a necessity for maintaining strength, independence, and overall well-being. Risk 5. Loneliness, depression, and loss of meaning in life. Do you ever feel like you are slowly becoming invisible to the world around you? Moving into a nursing home is not just a change of residence, it can be an emotional shock, separating you from family, routines, and the familiar comforts of home. Older adults don't just need medical care, they need love, companionship, and the reassurance that they still matter. The unfortunate reality is that many nursing homes focus solely on physical care, ensuring that residents eat, take their medications on time, and receive medical attention, while neglecting something just as essential: emotional well-being. Loneliness and depression are silent afflictions that many older adults in nursing homes endure. Some facilities lack recreational activities, staff are too busy to engage in conversation, and residents, unfamiliar with each other, often remain isolated despite living in a shared environment. The effects of loneliness extend beyond just feeling sad. According to a study by the American Psychiatric Association, older adults experiencing chronic loneliness are 60% more likely to develop depression and have an increased risk of Alzheimer's due to the lack of cognitive stimulation. A lonely mind often leads to a weakened body, as depression can weaken the immune system and contribute to chronic conditions such as high blood pressure and diabetes. Take the story of Susan, 85 years old. Before moving into a nursing home, she was active. She loved cooking, taking walks, and chatting with her neighbors. But once she transitioned to the facility, she felt as though she had been removed from life itself. No more family meals, no one checking in on her each morning, no one listening to her stories. Within months, she became quiet and withdrawn, losing interest in everything she once enjoyed. Her doctor diagnosed her with early-stage depression, warning that if it persisted, she could be at a higher risk of cognitive decline. How can this be prevented? Before choosing a nursing home, inquire about the availability of social activities. Facilities that offer group events, hobby clubs, or community gatherings help older adults maintain their connection to life. Music, games, discussion groups, and group exercises are simple yet effective ways to keep residents engaged and prevent them from feeling forgotten. Family plays a crucial role in combating loneliness. Regular visits, phone calls, and even small gestures, such as bringing a framed family photo, a favorite book, or a handwritten letter, can make a significant difference in maintaining a connection to the outside world. Encouraging loved ones to continue pursuing their passions, whether reading, painting, or writing letters, can also provide a sense of purpose. One often overlooked factor is the importance of friendships within the nursing home. If your loved one has a group of peers to share stories and memories with, time becomes more meaningful. A study from Harvard University found that maintaining friendships reduces the risk of depression in older adults by 30%. No one should spend their final years feeling forgotten. Emotional well-being is just as important as physical health. With the right environment, strong family support, and meaningful social connections, aging can be a time of joy, companionship, and purpose rather than isolation. If you're still watching this video and find these insights valuable, comment 5 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Not all nursing homes are bad, but it is crucial to understand the risks to protect ourselves and our loved ones. The living environment in old age is not just a place to stay, it directly impacts health, happiness, and overall quality of life. If we do not take the time to research carefully, we may find ourselves in undesirable situations, ranging from inadequate care and poor hygiene to the risks of depression and losing a sense of purpose. You deserve a safe environment, proper care, and respect. Do not hesitate to thoroughly research, ask questions, and observe firsthand before choosing a place to call home. Find a facility where you feel secure, valued, and cared for, both physically and emotionally. If you found this video helpful, share it so more people can become aware and take the necessary steps to protect themselves. And I would love to hear from you. Leave a comment sharing your thoughts or personal experiences on this topic. Together we can raise awareness and ensure that aging is a dignified and fulfilling journey.